Welcome to Health Matters on Channels Television. We are glad you could join us. I am Mary Alale Yusuf. Tuberculosis, or TB, is a potentially serious infectious disease that mainly affects the lungs. The bacteria that cause tuberculosis are spread from person to person through tiny droplets released into the air via coughs and sneezes. According to the World Health Organization, 1.5 million people died from TB in 2020, including 214,000 people with HIV. About 10 million people fell ill with tuberculosis worldwide in 2020, among them 1.1 million children. Child and adolescent TB is often overlooked by health providers and can be difficult to diagnose and treat. Globally, TB incidence is falling at about 2% per year, and between 2015 and 2020, the cumulative reduction was 11%. Now, that was over halfway to the End TB strategy milestone of 20% reduction between 2015 and 2020. So halfway there, but not quite. About 66 million lives were saved through TB diagnosis and treatment between 2000 and 2020. TB is curable and preventable. My guest is a consultant public health physician, Dr. Shalom Uni. You're welcome to the show, sir.
Thank you very much. It's good to be here.
Now, all those figures, they mean a lot to me.
Exactly.
Because we're talking about ending TB for several years now.
That's right.
And going down by 11% is not quite 20, but it's good.
Exactly.
But where is Nigeria? Because the WHO says that 8 countries supply 2/3 of the TB burden, and Nigeria is among them.
That's right.
So where are we in this whole scenario?
Well, unfortunately, Nigeria still has the highest TB cases in Africa. We are the first in Africa as far as TB is concerned. And that's alarming, and that's a quest for sober reflection. You know, we need to go back and see, you know, what are we doing wrongly, or what are we not doing well that we need to improve upon. There's what we call a global trend. A global trend can be reducing, while the national cases might be static, or you know, or
at least static is
exactly
a starting
increasing.
point. But
you
if
know,
they go up,
exactly. You see what happened with polio.
yes.
Even though global trends, polio is being eradicated, but Nigeria was still having polio cases till we now got a certification a few years back. So it's possible, you know, for the global trend to be reducing, but Nigeria is not just having a case. Right now, we still have about close to 500,000 cases of tuberculosis in Nigeria, and it's been said that there are many undiagnosed cases out there in the community, up to about 400,000 cases.
Okay, undiagnosed cases.
Yes.
That brings us to what kind of symptoms do we look for to determine that, or at least suspect that somebody has TB?
Basically, you know, characteristically, you want to look at cough, chronic cough, persistent cough of about 2 weeks duration, or cough on the spot for persons living with HIV/AIDS.
Okay.
You don't want to wait for 2 weeks of cough in persons living with HIV/AIDS. Once someone who is HIV positive is coughing, you must have a high index of suspicion that that cough could be a TB. But in otherwise normal individuals, persistent cough of 2 weeks duration, weight loss, significant weight loss, you know, in this community, in this environment.
People will be happy. I'm losing weight.
So significant weight loss, you know, that is not attributable to
any effort.
Exactly. So then you also look at night sweats. Some people call it drenching night sweats. That is, at night, there is proper ventilation, but you still discover that you're sweating. You know, your clothes, you know, your duvet, or not your pajamas, you know, sweat, or your bed sheets, or something like that. So that's also part of it. Fever, especially at night, elevated temperature. That's what we call fever. So that's also part of it. Then individuals who have been coughing for a while, they could cough and have blood stain, you know, sputum.
So why are we having so many undetected cases?
Well, it's a question for us in Nigeria really, because there are a lot of undetected cases in the community, that is still ongoing. Number one, we want to look at the level of awareness. Yes, there was a time that TB awareness gained ascendancy, in time past. But in recent times, the emergence of other disease and outbreaks has taken the shine away, from TB. For example, the world is just coming out of a COVID-19 pandemic. COVID-19 has taken the center stage in the last 2 years, so nobody's talking about TB. Then even prior to COVID-19, we were talking about other SARS, we were talking about HIV, malaria and other things like that. So that has reduced the awareness on TB. But, one thing we do on World TB Day, like we had on the 24th of March, is to create that awareness, one more time.
Do we have a problem of asymptomatic cases like we did with COVID?
Exactly. Yes, there are another reason why we also have cases that are undetected in the community. It has some of these cases, are not showing the symptoms. In otherwise healthy individuals, it's possible for someone to be infected with tuberculosis and not show the symptoms, at least for a long time.
Okay.
Because the person is well-to-do, you are eating balanced diet, your immunity is strong, you are taking adequate rest, and these are the factors that keeps the immunity strong. So you don't really see the ravaging impact of the bacteria in the health system of that individual.
I have a question. For such an individual who is healthy, the immune system is up.
Strong, exactly.
Is this TB inactive? Is it dormant?
In some cases, dormant. In some other cases, even active.
Wow. Such
individual might still be one of the sources of, community transmission of TB, because there's an ongoing sub-2 community transmission of TB right there. Because a lot of people are not complying, with their drugs. Some other individuals are not complying with hygiene, respiratory hygiene. Some other on the personal hygiene. Making three, then people are still living in overcrowding conditions, poor ventilated homes. That one's also ongoing. Then right now, the level of poverty has increased in the country, and in a way, that will reduce the access to balanced diet that individuals can have access to.
Okay,
and
we've got to remember that.
Exactly.
Poverty is linked to balanced diet.
Exactly, and in low socioeconomic class also. However, TB is not also limited to low socioeconomic class. The high socioeconomic class are also having TB, but then it's in them that you have these undetected cases, the middle and the high socioeconomic class.
Because they're keeping up with their...
They're keeping up, exactly. Taking adequate rest, living in hygienic conditions.
And eating well.
Eating well. But unfortunately, they got infected with TB because they had a significant exposure to other factors that can cause TB. For example, maybe they had a close interaction with someone who was coughing, and who is infected.
And unfortunately for TB, TB is droplet infection.
Exactly.
So, does it now mean that it will make nonsense of the COVID-19 distance we talk about, 1 or 2 meters? Somebody now coughs. That 1 or 2 meters, will it be long enough for the other person not to get infected?
Well, not exactly, but it is part of it. Now, even if you are 1 to 2 meters to an infected person with tuberculosis, if you stay significantly enough, 10 minutes, 15 minutes, okay, in the same environment, because as the person is coughing,
exposure.
Exactly, as the person is coughing, is releasing thousands, hundreds of thousands, in fact, in some cases, millions of the bacterium cells into that environment. So just that 2 meter is not enough. The most important thing is to make sure that you don't have a significant, exposure. Maybe face masking could help at a point, and begin to see, a relationship between face masking, and prevention of transmission of TB. Exactly.
It makes sense, Some of those things we did for COVID are making a lot of sense now.
Exactly.
But we have a vaccine that has been administered for years for TB, under the expanded program on immunization. Why have we not covered significantly, you know, enough people to have herd immunity?
Exactly.
I know all my children got the TB. I got it. So it's been on for a very, very, very long time.
Exactly.
What's happening?
Well, the BCG vaccine does not, at that early period of life, it's protective.
Okay.
But after a while, as you grow into adulthood, other things you now do, your earth-seeking behavior, your lifestyle, now further determines whether you'll be infected with TB or not. So we can say that
so it's not
BCG,
a vaccine for life.
BCG vaccine is not 100% protective for life. So that's where.
So is there anything like a renewal of the vaccine? Is there provision for such a thing?
Right now, according to National Program on Immunization, there is no place for taking a booster dose,
of
for
BCG.
No. But then this is where your lifestyle comes into play. This is where...
I'm sure a lot of people didn't know that.
Exactly.
When I was giving my kids BCG, I thought they will never, ever have tuberculosis in their lives, no matter how close they are to somebody with TB.
Exactly.
But now it's making sense.
Exactly. So people need to be aware of this, that for early childhood, the BCG, good, preventive, vaccine preventable. But as you move into adulthood, what you now do with your life now matters a lot. Even if you have received the BCG vaccine in childhood, if you expose yourself significantly, because there's what we call the risk of exposure, there's a risk of infection, then there's a risk of progression.
Okay.
So if you are exposing yourself and you have the risk of exposure, that is the presence, you staying in the midst or living with individuals who are TB positive, or you are having significant interaction with them, that's risk of exposure. Or you're having a risk of infection. For example, you're exposed to a virulent strain of the Mycobacterium tuberculosis, or your susceptibility is very high, because there are individuals that are highly susceptible, to the infection.
Or you've been sick.
Exactly. That's also part of it. So you're increasing your risk of infection or risk of progression. Maybe there are other comorbidities like diabetes, alcoholism, HIV.
We'll talk about that.
That's also.
We need to go on a break. We're going on a short break. Please stay with us to tackle the rest of this. Welcome back to Health Matters on Channels Television, and we are talking about tuberculosis, and Dr. Shalom Uni is in the house. Now you may tweet at CTV_Mary or send email to moalale@channelstv.com for your questions on tuberculosis. Dr. Uni, we were talking about the vagaries of this disease, and on top of everything, there are some they call multi-drug resistant TB, meaning that there are many drugs that it's resisting.
Exactly.
How serious is this problem?
Well, it's a serious illness because it's a complication. It's a complex case, and it's also an advanced case, of tuberculosis. For individuals who are compliant at this stage with medications, with follow-up, it's get through. But for individuals who are not compliant with medications at this stage, it's fatal. So as serious as it is, because it's life-threatening, multi-drug, it's life-threatening, but due to recent research innovations on drugs, we have enough drugs that can undo multi-drug resistant TB. But it calls for compliance. It calls for a lot of supportive systems, on the part of the individual. Otherwise.
So how difficult is compliance? I understand that these drugs have to be taken every single day.
Exactly. In this side of the country, or as a whole, we are not used to taking pills every day. We see it as a burden. There's a religious belief to it. There's a traditional belief to it. There are a lot of connotations to it. So it's a major issue for us, in this side, of the country.
But it's the only way out, right?
It's the only way out.
At the end of compliant treatment, Is TB curable?
Very curable. 6 months, you're out. Dusted, done and dusted, you're out.
So the important thing is to continue to shine that light of hope.
Exactly.
That you'll be out in 6 months.
In 6 months.
If you can
give
do
it
this.
all it takes. Whatever it is, give it all it takes. If you need to improve your diet during this period, there are times you come for testing, 2 months, 5 months, 4 months. You're supposed to present yourself for testing. You come back again for your testing. You take your drug. Don't wait for anyone to, to remind you. Although now we have linkage coordinators, we have TB adherence, counselors, we have, individuals who help you.
And then you have DOTS.
Exactly, we have DOTS, exactly.
Please explain what DOTS is. Well, we need to know.
Yeah, DOTS is the directly observed therapy short course. We call it DOTS, DOTS. It's a program whereby individuals who are positive with tuberculosis come to the facility and take their medication in the site, in the presence, of the health worker.
So you watch the person
them
taking his meds.
Yes, you do that for a period of 2 weeks. Now it is snatched into 2 weeks, but before, it was 4 weeks, 8 weeks. But due to distance, due to economic implications, now you do for 2 weeks. But an individual, a partner, a TB adherence, partner from your house, someone who is close to you, who will ensure compliance at home, is expected to follow you during this period of time, so that the person also studies how you are taking it, studies how you are being given, and so that when you are out of DOTS, they can continue that with you at home. So that's directly observed therapy. We want to see you take that drug in our prem, because the impact of non-compliance is fatal.
So how is that working now? This directly observed thing with officers following up and everything, is there any improvement?
In every TB center where treatment is being carried out, DOTS is taking place. So it's working well. It's one of the ways to ensure compliance. Many individuals have come to see what they are up to, and they are taking. It's even now easier. Before, you have several pills to swallow, plus the injections. There was a time when streptomycin injection was part of it, but now we just have the pills, the capsule to swallow, and you are good to go. So it's even better now, and a lot of people, are improving. But then, so much work still needs to be done to strengthen the systems and the structures that ensure compliance in individuals.
They say that HIV patients are like 18 times more susceptible to getting TB.
That's right.
How are you handling this with the complication of COVID on top again?
In fact, in a lifetime, HIV patients are 50% at risk of getting infected with TB in a lifetime. In a year, 15 to 18% in a year. So they are really at risk. Now, coming with COVID-19 also, that becomes so many comorbidities. So you take it step by step. That you're HIV positive doesn't mean you cannot take the COVID-19 vaccine. No, you can. Then your TB patient, especially one that is not showing you're not symptomatic. You're using your drug regularly. Your sputum testing, are showing negative. You can also take.
Oh, you've raised a point that I want to tackle.
So it doesn't stop you. Yes.
Somebody who has TB without symptoms taking drugs.
Exactly.
How do you catch such a person? How do you even know there's a person with TB who is not showing symptoms?
Now, it's difficult. But this is where screening comes in. Screening those who are at risk comes in.
Okay.
For example, people living with those who have TB, they are a group of people who are at risk. People at work with a staff who just got diagnosed of TB, they are also at risk. So do screening for them. There's something Lagos State did recently, and they have these mobile vans, mobile TB screening program, where you do an X-ray, and they can check through your lungs, because there are some individuals that even with their sputum test, you don't get any results. You diagnose the TB from the X-ray. Is it the X-ray that shows you what is going on? Is that
the most reliable method of diagnosing TB?
Well, the first line of diagnosis of TB is the sputum test.
Okay.
However, there are different ways by which you can diagnose TB. There is the bacteria confirmation, sputum confirmation. There is clinical confirmation. You know,
Is that blood?
no, clinical confirmation is what you are, your symptoms, your signs and symptoms.
Okay.
The bacteria is when we do a gene expert test for you. We take the sputum test, we do a gene expert test for you. You produce just one sputum test, sputum sample, and it is done in the laboratories, and it is confirmed whether there's TB or not. So it can also be confirmed. Then there is other X-ray. Under the clinical diagnosis, there's other X-ray. Some sputum tests come back negative, but the individual has TB. So, but when you now do an X-ray, it's able to show what is going on in the chest, and the TB X-rays are characteristic. TB X-rays, when you see it, you can't miss it. It's a TB X-ray. So, in such individuals, it is the X-ray that gives it away. So, then there are some other individuals that also have comorbidities. For example, in diabetes, in those who have other illnesses.
I have to quickly ask you a question. With all this coughing and sneezing, you have things that land on surfaces.
That's right.
How long does this virus live outside of the host?
Now, for tuberculosis, you're talking about COVID-19, yes, the virus. Talking about tuberculosis, it's a bacteria. Now, bacteria doesn't, you don't get contact with TB, through the surface. It is usually the inhalation. It is virus that succeeds. It is virus that survive for more days, on surfaces. Bacteria don't have that. Okay. So, majorly, TB is transmitted, not barely touching on surfaces, but inhalation of what is being produced at that moment. However, it also calls for hygiene of surfaces, because individuals can spit. In fact, you said something about sneezing and coughing. Spitting also. If somebody's spit touches the surface and you put your finger there right at the moment, and as a poor lifestyle, you put that in your mouth significantly, maybe that spit has enough concentration of bacteria, sure, the person is going to have it.
Dr. Oni, it's been very interesting, but we've got to end here. Thank you so much. I could see you were rushing because you have so much to say. Thank you so much for coming.
Thanks for having me.
Thank you for being with us, and have a great day. I am Mary Alalelisi.